Relieving pain. This is for a patient who had a hernia surgery and injury to the nerve happened, and now there's a bunch of pain that's associated with it. And we're going to just see if we can be helpful to that, help the healing process, clear out the trauma so that this injury and surgery can heal as much as possible. So step one, we're going to treat the organ from the belly button. We're going to go 1 inch out and 1 inch up, and we're going to push into the abdomen right there. And we're going to do a circular massage, pushing about as hard as we can for a minute or two. And I won't record all of that, but this is step one. Pause and push for a minute or two. And while we're treating these points, we might think of the emotional stress around this. Perhaps in a surgical situation, we listen to somebody's advice even though our gut was saying no. And now we kind of regret the choices. And if that's the situation, just kind of think about that, because we're moving energy, and if there's any negative emotions that are associated with that, we want to move that through as well. Step two, we're going to do the small intestine reflex point, which is under the ribs to the sides and the insides of the thighs from your groin down to about mid-thigh. We're just going to poke in, and we're going to do what I was taught is called injury recall, which is pulling down on the ankle like this. I just flick the thumb downward. You can also pull straight down like that. And keep that handy. Push in, flick, flick, push in, click, click, push in, click, push in, click. And definitely if you find anything tender, hold that pressure for a few seconds and click, click. And then the other side, we're just starting from the top of the ribs, pushing in under the ribs, clicking under the ribs, all the way down to the sides. Any tenderness, stay with it for a second. Just hold that pressure for 10-15 seconds. And we may bring in the emotion of the trauma. You know, surgery is a trauma to our body, and so we're just thinking that in our mind, how it went. And then the insides of the thighs, get in really close to the groin there, clicking down the insides, really close to the groin. And we're just resetting the trauma response to those organs. The trauma response to anything is tension, tightness, and so our head pulls in, our feet pull up to any pain or trauma response. So cutting into the body is a huge trauma response. Then we're going to do the small intestine face points, and we can contact the scar and push into that as much as we can and tap. We want to do both sides right in front of the ear, pressing in to that scar, and maybe where the nerve got hurt, you can kind of follow that path as well. If it's coming around this way, you would do it on the same side. So tapping here. So small intestine face points, touching the scar and the area of pain. Step four, now we're going to get into the scar a little bit more. You may want to lay back and push directly into now you're doing more of a massage right into that scar. This is where you might put something like calendula or frankincense into the castor oil, something that's healing to these, black currant seed oil, wheat germ oil, and then do the click, click, click. So we're resetting the trauma response directly to the scar for that one. After we reset the trauma response, we can just treat the meridian that goes down there, touching and tapping here. And then the side of the eyes is the side of the body, so we'll do some tapping there and go through that nerve path that we feel pain in. And just tapping here, wherever you find that tenderness, tapping, tapping, tapping. And then just one nice trauma response release at the end. And then let me know how it goes.